It's important to find the right healthcare plan that fits you and your family's needs. And now that open enrollment is going on, there are a number of things that you should consider. I'm joined by Dr. Kevin Shih with WellMed. He's going to share with us some tips for open enrollment. So nice to meet you. Welcome to Texas today.
Yes, thank you for having me here.
Of course. So first of all, can you talk to us about WellMed and its mission?
Yes, WellMed is a group of primary care clinics located in Texas and Florida. We do primary care, which is managing a lot of chronic conditions, managing medications, managing specialists. And we try to do a well-rounded patient approach to make sure we are covering all the bases, making sure you go see the right doctors, have the right medications, and make sure overall patient well-being is monitored.
A lot of us keep hearing open enrollment. We have no idea what that is or why it is important. Can you talk to us about that?
Yes, open enrollment is a period every year when insurance companies allow patients to change their policies or pick new policies. Now, there are several time periods for open enrollment depending on what type of insurance you have. The most common is Medicare open enrollment. There's also open enrollment for people with employer plans, other plans, and then you also have people who can have open enrollment for their healthcare.gov plans, which is the open marketplace plans. So to find out what period your open enrollment is, it really is important to talk to your insurance company.
Very nice. And when we're looking for a health plan, what tips can you give us when it comes to figuring out what works for us?
Yes, so the first thing to do is to really look at your annual notice of change if you have insurance, and that will tell you what coverage changes occur if different services are taken away or medications are taken away. So that will let you know if you should change your insurance plan. Second, you should look at the benefit coverage of each plan to see what type of providers you can see, what type of medications are covered, what type of network you have. You should also familiarize yourself with terms such as co-payments, deductibles, premiums, because those will all go into determining what type of plan you should choose. Other than that, medical-wise, you should look at what type of medications you take. Certain plans will cover generics, and if you are on specialty medications, you should check to see what those plans will cover. If the plan no longer covers your medication, you could be liable for those costs if those changes take into effect and you haven't taken action. Another thing you should look at is what type of care you're anticipating in the future. If you're looking for some sort of surgery, you may want to check to see how much percentage you will be covered and how much you'll have to pay out of pocket. And those things may affect how you plan that year's health coverage. Other things to look at would be networks for doctors. If you have a particular specialist you like to see, you should make sure that they are still covered in that plan. Sometimes providers will fall off those plans and you may not be able to see that doctor. You should also check for other benefits such as vision and dental and hearing. Some of the new Medicare plans, especially the Medicare Advantage plans, will have those benefits included. So you may, if you're interested in getting some dental work or hearing aids, those are things you can look into as well.
For somebody watching who might have more questions, how can they reach out or find more information?
Yes, so if you have any questions, the first place to look would be Medicare.gov. They have a list of certain plans which they rate higher with Medicare.
Okay.
Other sources can be insurance brokers. If you have a broker, you have questions you want to ask, you can contact your broker. And then you can also reach out to WellMed. We have different clinics in the DFW area who can help you find a PCP or help you establish care if you get a new plan.
Perfect. Well, thank you so much for joining us and for sharing all this information with us. Very helpful.
All right. Thank you very much.
A reminder, you have until December 7th to pick your Medicare plan. To learn more or to get help with open enrollment, go online to wellmedhealthcare.com to get started today.